Mental Health Concern in Oakdale is a partnership that came about a couple of years ago. Mental Health Concern, as you know, is a local charity based in Newcastle, and Oakdale is the largest provider of psychological therapies in the UK, based in Harrogate. So the directors of both those two organisations came together a couple of years ago when the whole IAPT regime kicked off, with a view to utilising some of the infrastructure in the North East that Mental Health Concern have, with some of the experience in delivering therapies that Oakdale have, and delivering that together in Northumberland. I think the overriding values and principles of MHCO are twofold. One is sort of having a hard working ethic, and the other one is loyalty. The third one I would put into the mix there is utilising innovation. So in terms of the therapeutic delivery so far, we've embraced things like telephone therapy, and we've proved the efficacy of telephone therapy as opposed to face-to-face therapy. We've also used computerised CBT as our model of delivery. But apart from that, it's an organisation that has far less bureaucracy than a typical historical mental health provision, and by that I mean that the bulk of the work is done out there on the coalface by the therapists at step 2 and step 3, with not too much intervention by management. My fundamental responsibility is to make sure that the whole Northumberland IO service ticks, and clearly with a team of therapists who are client facing and working very hard for the clients, there's a need for comprehensive supervision. And that takes place in 3 different facets within the service. We have clinical supervision, which looks at things like risk. It looks at things like any child protection issues, any vulnerable adult issues that may be present there. But another important factor of the service is what we call case management. And case management just makes sure that the service ticks over effectively, and it's making sure that the therapists are fully loaded with the right number of clients and the right type of clients, and that the venues that they have are suitable for those clients. So one of the tasks that we had in the early days was making sure that we had appropriate venues, therapeutic venues for the delivery of our service, and that was particularly problematic. We felt as though we could run out of GP surgeries, but what we found in that was that it wasn't really conducive to common appointments week after week, and we had to then take a backward step away from GP's appointment and look at community venues which were non-stigmatised, which were local, and we could be accessed by public transport.
The kind of people that we see in our service are usually people with a range of depressive disorders or anxiety-based disorders, and what we'd do is we'd look at, with them, we'd try and find an idiosyncratic understanding for them of when a situation occurs in their life, how they think about it according to their own belief system, how it then affects the way in which they feel, and what they do. And often what we find is some of the behaviours that they use are quite unhelpful. For example, they might withdraw from friends and family, avoid situations, or they might use unhelpful behaviours, i.e. drinking too much, using illicit drugs.
We choose settings which are clearly non-stigmatised, and here we are in a beautiful setting in the middle of Morpeth here, and our therapy centre is just up the road there, on the bus route, in between the shops. You would never think it was a setting to deliver any mental health services in there, and the reason we do that was primarily for consistency in the first instance, but since that day we've had various service user groups present, and some of the feedback we've had on the choice of venues has been absolutely first class. So we now think it's an important part of the therapeutic process to have a venue that's appropriate for that therapeutic process.
We have quite a flexible service where people can self-refer, or a GP can refer on their behalf. So a client could ring the service and immediately speak to somebody on that day. We have lengthy opening hours so that it's convenient for people who might work, which is a high proportion of people we do work with. They'd ring the service, and what we do is take a very brief history of what's been going on. And then what we'd do is we'd arrange a practitioner to ring them back and speak to them within 3 working days. And that session would be over the telephone and last between half an hour and 50 minutes. And we'd just take a little bit more detail. We'd also be looking to assess risk on that day as our most important priority. From then on, we'd make a recommendation based on what they told us as to how severe the problem might be. If the problem is quite an early onset and that person is functioning very well and might just need some support, we'd refer them to a wellbeing practitioner, maybe for some guided self-help, or we might provide them some literature. But other than that, if people feel like this problem has been quite long-standing, quite often they haven't received any psychological help in the past, and that's usually when we would refer them to a step 3 level, which would be what I tend to do, face-to-face therapy. From then on, what we'd do is we'd start to look at the problem areas with that person on a face-to-face level, looking at between, on average, 12 to 18 sessions, up to a maximum of about 20.
In terms of the future, I think that MHCO want to position itself as the leaders of change within mental health service provisions. And by that, what I mean is that we want to be the benchmark that other people look up to. So we know that the future of IAPT is certainly changing. It can't be improving access forever. I think that MHCO have certainly improved access in terms of self-referrals, in terms of opening hours, and just in terms of the general ease of access for the public going forward, and that's what we want to be known as. And we know that the scope of IAPT is growing as well, so we want IAPT to be positioned right at the front of that growth. If I was to ask a service user what they thought of the Northumberland IAPT service and MHCO in particular, what I would hope that they would say was it's a thoroughly professional organisation, an entrepreneurial organisation, a caring organisation, and one that puts the service user at the front of that. So all the decisions that we take are taken with us, the service user at heart.